We hear so much about AI, picking our next movie or maybe someday driving our cars. But what's really catching my eye now is how it's changing healthcare, like our healthcare.
Yeah, it's moving really fast. Forget the sci-fi stuff. This is actually happening.
Right. And that's what we're getting into today. We've been looking at this source, the future of AI in healthcare. And it's a mix, isn't it? Huge promise, but also some real hurdles.
Exactly. Our goal here is to kind of cut through the hype and focus on what you really need to grasp about where this is heading.
And it's pretty broad. I mean, we're talking AI looking at medical scans, potentially spotting diseases, certain cancers way earlier than we might normally.
Imagine catching something really early. That's potentially life-changing.
Huge.
And it's not just about finding problems. It's also making the system itself work better. Think maybe shorter ER waits, hospitals using their resources smarter, that kind of thing.
Okay, and then there's the really cutting edge stuff like drug discovery. DeepMind's AlphaFold comes up a lot. Game changer, people say. What's the quick version for us?
Right, AlphaFold. So basically, it cracked a massive problem figuring out the 3D shape of proteins just from their basic sequence.
Okay, and why does the shape matter so much?
Well, the shape determines what a protein does. Knowing the shape lets scientists figure out much faster where a potential drug might attach or even design new drugs from scratch. It dramatically speeds up that early research phase.
Got it. Speeds things up. And that connects to this idea of personalized medicine, right? Treatments just for you.
Exactly. That's the big dream. Moving away from one size fits all. The source mentioned a hackathon, actually, at Kathmandu University.
Yeah, they were looking at genetics, biomarkers.
Right. That's the ground level stuff. How do we actually use your specific biological data, your genes, maybe protein interactions, to tailor a treatment, make it more effective, fewer side effects? It's about precision.
So, okay, our mission today, navigate this, see the cool possibilities, but also, keep our feet on the ground about what it takes to get there.
Sounds good. Let's dive into that potential first. The source uses this phrase I liked. AI as a supercharged doctor. What does that really look like in practice?
Well, I think it boils down to speed and accuracy, right?
Okay.
Especially with diagnosis, like we mentioned, analyzing images, scans.
hmm
The source points to examples, like spotting early signs of certain cancers, maybe even years earlier than the human eye might catch them. That early warning is, well, it's everything sometimes.
Absolutely critical. And it's not just images. AI can sift through mountains of patient data lab results, history, notes, finding patterns, maybe a single doctor, even a great one might miss.
Ah, okay, so it sees connections we might not.
Potentially, yes. Leading to insights across a whole range of conditions, maybe spotting risks earlier.
And you mentioned hospital efficiency too, so less about diagnosis, more about the logistics.
Exactly. Predicting patient surges, optimizing bed usage, maybe even streamlining operating room schedules. It sounds mundane, maybe, but it can really impact the patient experience. Less waiting, smoother processes.
Makes sense. And back to that personalized medicine idea, it feels like such a leap. How does AI actually do that tailoring?
It's about processing incredible amounts of data for one person, your genetic code, your medical history, lifestyle factors, maybe even data from wearables. AI algorithms can analyze all that complexity, find subtle links, and help predict which treatment is most likely to work best for you.
So fewer side effects, maybe faster recovery.
That's the goal, much more precise interventions.
Okay, this all sounds amazing, but the source definitely pumps the brakes a bit too. It calls AI the Spider-Man of modern medicine.
Yeah.
Great power.
Great responsibility. Yeah, and implementing this stuff is complex. There are some major hurdles.
Like what? What are the big ones?
Well, first and foremost, data. AI is only as good as the data it learns from. And medical data can be messy.
Messy.
It's often scattered across different systems. Sometimes it's incomplete, maybe outdated, not standardized. If you train an AI on flawed data, you get flawed predictions. Garbage in, garbage out, basically.
Which could lead to, well, bad outcomes.
Yeah.
Misdiagnosis, wrong treatments.
Exactly. That's the risk. So getting clean, accurate, standardized, and accessible data is absolutely fundamental. It's a huge challenge.
And I'm guessing it's not cheap either, putting these systems in place.
Definitely not. It requires significant investment, the tech, the training, integrating it into existing workflows.
So could that create, like, a gap? Hospitals that can afford it versus those that can't?
That's a real concern. The potential for widening the healthcare access gap is there. Wealthier systems might leap ahead while less resourced facilities fall behind. We need to think about equity. How do we make sure everyone benefits?
Yeah, that's crucial. And what about the doctors themselves? I imagine there might be some skepticism, trust issues.
Oh, absolutely. Doctors build expertise over years, decades even. Their judgment is based on experience, training, intuition sometimes.
Right, so how does AI fit in without feeling like a threat?
That's key. It has to be positioned as a support tool, an assistant, something that provides extra insights, flags potential issues, maybe handles some routine tasks, but doesn't replace the doctor's final judgment.
So it's about augmenting, not replacing.
Precisely. And that requires really good training for the clinicians, clear evidence that the AI is reliable and helpful, and transparency about how it works. Building that trust is essential.
Okay, so data, cost, trust. Those are big hurdles. Now, the source brought up an interesting case study, neurovision. What's that about?
Right, Neurovision. It's a project using AI, specifically deep learning, to analyze brain scans DICOM images to help classify brain tumors.
Okay, so applying AI to a specific complex problem.
Exactly. And what's interesting is how they're apparently trying to build it responsibly, thinking about those challenges we just discussed from the get-go. They use cloud computing for the heavy lifting, processing power, and data storage.
And how are they tackling things like data privacy or bias?
Well, according to the source, they're focusing on strong encryption and privacy measures for the patient data, which is obviously super sensitive.
Yeah.
For bias, they're aiming to train the AI on diverse data sets, different patient populations, different types of scans to try and make it fair and accurate for everyone.
And the trust issue. The black box problem where you don't know why the AI decided something.
They're apparently working on explainability using techniques often called XAI, explainable AI, to help doctors understand the reasoning behind the AI's classification. So it's not just a magic answer, there's some insight into how it got there.
Okay, so trying to make it more transparent.
Yes. And critically, they emphasize collaboration with doctors. The AI is an assistant providing information, but the human expert stays in charge, validating the findings.
So neurovision sounds like maybe a model for how to do this right, or at least how to try.
It seems like a good example of trying to integrate the tech thoughtfully, balancing the innovation with those ethical and practical considerations.
Which brings us to the path forward more broadly. How do we make sure this AI revolution in healthcare actually works for everyone responsibly?
It's got to be a joint effort. We definitely need clear guidelines, maybe even regulations around things like data security, fairness, accountability. Who is responsible if an AI makes a mistake?
That's a tricky one. The doctor, the developer, the hospital.
Exactly. And transparency is key, like we saw with Neurovision. Patients and doctors need to trust these systems.
So it's about teamwork. Developers, doctors, ethicists, policymakers all working together.
Absolutely. The source sort of implies a three-legged stool idea. You need the innovation, the responsibility, and the trust all working together. It has to be human-centered.
Are we seeing positive signs? Are people actually doing this?
Yeah, there are encouraging developments. Hospitals are starting to test explainable AI systems. Governments are discussing ethical frameworks. There's active research into identifying and mitigating bias.
So it's happening, but it's ongoing.
It's definitely an ongoing process. We're learning as we go, adapting as the technology evolves.
Okay, so wrapping this up, looking at the big picture, AI in healthcare, what's the main takeaway? What's the potential impact for, us?
I think the biggest promise is ultimately better health. Quicker, more accurate diagnoses, treatments that are more effective for you, potentially leading to healthier lives overall.
But, and this seems really important, it's a tool.
Right.
It's here to help the doctors, the nurses, the healthcare professionals.
Yes, precisely. It's about augmenting human skills, enhancing their capabilities, not replacing that human element of care, which is irreplaceable.
So here's maybe a final thought for everyone listening. Building on that neurovision example and this idea of responsibility. As AI gets deeper into our healthcare, how do we make absolutely sure it always puts humanity first? Upholding ethics, fairness, keeping that trust. Where do you think those lines should be drawn? Something to chew on as this technology keeps evolving.